So what
Okay.
are the subjects in final year?
The final year subjects are medicine, surgery, orthopedics, uh, obstetrics and gynecology, and pediatrics.
Right.
And first, can you tell about the books that you referred for medicine, Priya?
Yeah. So medicine again, there's theory and there's the clinical aspect. So
Mm-hmm.
for theory, the go-to book which was there from the start to the end was Archit Bulur sir's book. So that covered every topic, every unit which is coming for exams. It had everything. That's a very
Mm-hmm.
exam-oriented book because everything is. I mean, under each unit, everything is there in the form of Q&A pattern in the book
Mm-hmm.
itself, and it covers all the headings which are there with flow charts. And if, for example, you pick up any topic like pleural effusion, so that again there will be a little bit about the introduction, and then you will have the causes of pleural effusion, the
Mm-hmm.
symptoms, how on examination, what are the findings which we'll find, and then the lab investigations and all the other investigations that we're supposed to do, and with that, how it is managed. And even some other chapters where you have the treatment, even that is given in detail. Like, for
Mm-hmm.
example, diabetes, all those insulin analogs and all the oral hypoglycemic drugs, we don't have to refer to a separate textbook for the pathopharmacology part and all because everything is given
Mm-hmm.
itself. So Archit Buller was the go-to book. And in addition to that, there are these small subjects which are also included in final year and which comes in general medicine paper too, usually for RGHS, which is dermatology and psychiatry.
Psychiatry.
That was included in the same textbook.
Same thing.
That made things simpler because we did not have to open, 2, 3 other
Mm-hmm.
books during the final exam. So that was one. And my reference, which I used, was API textbook of medicine.
Mm-hmm.
So that was like a very brilliant book to read because it's got most of it has got all the Indian data which is there.
Standards.
Yeah, and the other thing was, so each chapter which is there is actually given very nicely with
Mm-hmm.
tables, with facts and figures which are there. Even that has good flow charts. I think the latest edition has come out with all the colorful flow charts and stuff, so that makes it more interesting to read. So these were
Okay.
my two books for theory. Did you have
Mm-hmm.
anything else?
No, I referred Archit Bolser's book itself.
Okay.
And for clinical medicine also, I refer the same Archit Bolur sir's book itself. And it is given in detail, great detail, and it is a wonderful textbook and all the clinical methods, how to examine for the general examination, all the pylorictus, sinus, etc., and JVP measurement, pulse measurement, all the vitals, how to do everything is given in very great detail. Then each system examination and different, like in respiratory system, what is the cause of hyperresonant note, dull note on percussion, different causes. All these things are given in very nice detail. In tabular columns it's given. And in CVS and CNS examinations also, various methods, how to do reflexes. I think CNS examination itself is about 140 pages. I'm not sure about the number, but it's a very large number. But and it's given in wonderful. It is given very wonderfully, and I don't think you have to refer any other book for clinical method itself.
True, true.
And for Viva, medicine Viva, you can refer Kundu, which is also a very nice book. And all the it is given in a question and answer format. And for each case, what questions the examiner might ask, they have given a detailed answer. And how do you approach? Like they have, he has given in after each case, he has given how do you tell that this is this case. How do you tell it's a pleural effusion? How do you tell if it's a pneumothorax? How do you tell it's an alcoholic liver disease? He has given reasons for that, and it is a very nice book. It's concise and it's good.
Right. So that covers with it. I think a couple of other books which are used for theory. I know a couple of friends who've used George Matthews also. Some
Mm-hmm.
of them have also referred to Davidson's, but usually just to refer. Because
Mm-hmm.
they say that for theory examination, it's not enough. The content which is given is not enough to write a full-fledged 10
Mm-hmm.
marker or a 5 marker. So
Mm-hmm.
I think that in view, Arsit Bulur sir's book itself was, it's like everything is there in that one book.
Yes, sir.
So that is the beauty of it. And it also, the practical book, another reason why it's really good is because, I mean, in addition to all the clinical methods of examination and stuff, he's even given the format of writing the diagnosis for
Yeah,
each
yeah,
case, whether it is CVS, RS, CNS, or per abdomen.
yeah.
And even the short cases which might come, that one's pro forma is also there.
Given, yeah, this scleroderma, rheumatology cases,
Hmm.
and hypothyroidism, all these things are also given.
Yes. And added thing is that in the ending, there are chapters on X-rays and ECG reading.
Mhm.
ECG,
ECG reading, then or also this instruments also are given. All this Viva aspects are given. Drugs, etc., are also
so
given
it's
very
like
nice.
an all-in-one book
Yeah.
that way. So that is about medicine. Then we'll move on to surgery.
Yes. Mm.
Right.
Uh, Personally, I referred to in for theory. I referred to Manipal Manual of Surgery by Professor Rajgopal Chennai sir. It's a wonderful textbook, and the font size is also good to read, and it's given in a proper order. What would be the causes, pathogenesis, and the clinical features, signs, symptoms. Then how do you manage it medically, surgically? What are the important methods which are used before, which is now preferred? All these things are given a very nice manner, and the clinical part, like the cases which are all which would be kept for us, these things examination also he has given in a wonderful manner, in a proper great manner before the start of the theory. He has given it in very beautiful manner. So I suggest Manipal Manual of Surgery, especially for gastrointestinal system. It's a very nice book for GIT, and yeah, um, and SRB textbook I use for general surgery.
Hmm.
It's given in great detail. Everything is there. A lot of information is there in the book, and many clinical photographs are also given, and a few points are given in highlighted manner in different
All these
boxes. Which,
points, right.
yeah, all those things are given in boxes which would be useful in Viva also.
Right.
Uh, what did you prefer, Priya?
So one thing is, I mean, so this textbook of Bailey and Love, which is considered as the standard textbook in surgery, and that comes
Mhm.
in two parts actually. There are two books for it. So I mean, if one really wants to get into the depths of understanding surgery, that is indeed like the go-to book. Only
Mhm.
thing is, so for before the examination, that would be a little too much to study and remember from. So in that case, Manipal and SRB will be the books. I
Mhm.
refer to SRB for most of surgery actually. But GI again, like you said, Manipal manual is
Mhm.
actually pretty good for it. The general part of it is very well given in SRB.
Mhm.
So how he has given it is like how Sir has put it in his book is that you first have all the theoretical aspects, and at the end of it there are these small boxes which will again summarize
Mhm.
whatever is given.
Yeah.
And the flow charts are like pretty nice, and you also have
Mhm.
common to both the books are that the diagrams which are given in both the books are very nice for exam.
Mhm.
So that
Yeah, and in SRB's, he has given all more of clinical photographs, which are also there in Manipal. And in Manipal, there are many handwritten diagrams that you can draw in exams.
right. So that is one bit, and then the second aspect of it is the clinical part of it. So
Mhm.
which textbook did you refer to?
I referred to SDAS in the beginning, and for the basics for SDAS. Then I referred Raj Mahendran short cases and long cases for exam purpose itself. Like all the long cases and short cases are given in great detail. All the how to examine and what is the importance of each step and each thing you have to ask in history. All these things are given in great detail, and it's a pretty short, very pretty thin book, only this much. And it would be a handy book to go just before your exams. You wouldn't have a lot of time to refer to your theory aspects or go through das. And so I would tell it's a very nice book to refer to for your exams and also for all your clinical postings as well.
Right. That is, of course, these two textbooks form the
Mhm.
standard as far as the clinical aspect is concerned.
Yeah.
Because other books that I have come across is ML Saha sir's book also.
Mhm.
That again has it mostly for the Viva aspect. I mean,
Mhm.
each case, the proforma is given first, the pattern of diagnosis, and then everything is given in terms of Viva. like a Q&A pattern. So that's almost like reading Kundu for medicine.
Medicine.
That again one can refer to, like probably before their end postings coming through, that is the ideal time when you can like read this textbook and then just go through the Q&A pattern of it. Yeah.
Mm-hmm.
The other aspect of it is, I mean, for all these subjects that we have in final year, I mean, I too used all the White Army case videos itself.
Yes, it is. Yeah.
Yeah, so that covered like all the Q&A except for the parts where the clinical demonstration aspect of it, everything you have to grasp during clinicals itself.
Clinical itself.
Very, very important. One cannot bunk that in final year, because
Mm-hmm.
each right from day one to the last day, whatever you study is what comes during exams. But in addition to that, how to what questions you ask, what is the relevance of each of them, and all the other questions that you routinely comes in Viva has been covered very well in all our videos, and the manner of presentation also.
Mm-hmm.
Yeah, so that is about surgery. So the next one, yeah,
orthopedics. What did you refer for orthopedics, Priya?
so the textbook was Maheshwari.
Mm-hmm.
That is the book that we all refer
Go
to.
to. Yeah.
Yeah, and surgery again for us in RGHS, it's like paper one has 50 marks of general surgery and then 50 marks of orthopedics. So that is where we use the textbook for, which again is concise. It's very nicely given in Maheshwari. Only thing is like in ortho, it's like so just the usually when you study surgery, all the relevant anatomy comes in the first of the chapter itself, the starting. For orthopedics also it is there, but it is very small. So if one needs to know more about the joints and all of that, you can always go back to anatomy and study that bit. Then come back because everything is there. Most of that we need, for fourth year is given in the textbook. And for clinicals, again, S class itself covers all, yeah, aspects of it, most of the examination points. So,
and for the instruments and x-rays, in the textbook itself, in Maheshwari itself, in the end they have given.
right.
And also in Maheshwari, in the end annexures, they have given few clinical methods also.
Yeah.
And how to write the case format. All these things are also given in Maheshwari also. If you want to refer that, you can refer that also.
True. That is also there. So that covers orthopedics as well. Now we'll move on to OBG.
Yeah. I referred Datta textbook for obstetrics and Shaw's for gynecology. Datta obstetrics is given pretty well and in great detail in points, multiple points, and they have given in detail that you can write for exams in the same way. And also the diagrams are also there if you have to put few. And the first 14 chapters are the basics of obstetrics in that. You have to know what's normal in a pregnancy if you want to know what's abnormal later on. So if you're strong with the first 14 chapters, you can study the remaining chapters very well. So that's what I would like to tell.
In fact,
And then
it's covered in the second year onwards. The first 14 chapters is done with it. Start with all the others in third and then the final year.
Yeah. And for Datta is good for clinical also. If you know, actually for OBG, you don't have to refer to a clinical book as such, but then there are multiple clinical books as well. One of it is Sharmila Arun Babu. It's a pretty new book, but it's a very nice book, and it's given in great detail about some 10 obstetric cases and 10 gynecological cases are given, and each of them have been covered in great detail, and they have given she has given all the history format, the case format is given, and why you ask each question in history, how do you examine, everything is given. Then relevant theory aspect as well has been given, and viva questions are also highlighted in the book. And for few topics which I couldn't complete in the textbook, I went through it in the this book itself, like postpartum hemorrhage, and then infertility. All these things I had read from this particular book itself. Multiple flowcharts are also given, so it's a nice book to read for practicals. Also, instruments and specimens, cardiotocography, non-stress test. All these things are also mentioned in great detail. Partograph also is given, so it's a nice clinical book for obstetrics.
That sums up for obstetrics. I mean, Datta is the go-to book for obstetrics as far as it's concerned. And the clinical part, one other textbook which I refer to it's a green color book. So that is authored by Hepzibah and Kirubamani. So we use that as well. So I mean, it's left to everybody out there. Like, always pick up both the books, compare, and whatever you feel comfortable with, take that and read it. So that will come handy. Either of these books come handy before the practicals. It's very difficult to open the big fat books right before practicals and flip all the pages. So to keep that short and sweet one, we'll refer to the practical books. So for gynecology, like you mentioned, Shaw, I think Shaw and Datta are like the combination which most follow. Yeah, and I had Datta gynecology also with me. So where it came handy for me was that in a lot of chapters were given in points. All the chapters in Shaws which are there, usually it's given. It's a very nice book to read through. And the only thing is, it's all there in paragraphs. So last minute while flipping through it, unless we've made our own notes, things get a little confusing there. So that is where I refer to Datta towards the ending. Yeah, but Shaw's like especially
it's a standard book, and especially this. I like the book where in this cancer cervix, cancer endometrium, body of uterus, all those things. It was given in a very nice manner, and this cancer ovary also was given in a very detailed manner. It was very nice. Also, this genitourinary tract, this vesicovaginal fistula, all these things are also given in a good manner. But the thing is, in Shaw's, few surgeries are not given in detail, or prolapse and all. So for this, you have to refer to Datta separately. And
otherwise, even in the clinical book also, it's already
clinical book also it will be given in the end. So that would be great.
That way. So that is there. And then again, postings, nothing can,
beat postings.
That's a
You have to go to postings and you have to learn. You have to know the basic grips. Without knowing grips, you can't pass obstetrics.
They will ask you. If it turns out to be bedside, so they will ask you the grips at any point. So that is very important. Otherwise, the proformas in all the cases remain the same. It's only the HCI part which changes depending on whether it is a case of preeclampsia, gestational diabetes,
VDM, anemia, etc.
Otherwise, the entire proforma and the manner in which you write the diagnosis is the same in OBG. So that is the point of least confusion, I should say, as far as OBG is concerned. So that is done. And then we have pediatrics, which comes as so all these above subjects were all 2 papers, 200-mark papers in RGHS. And then we have pediatrics, which is a
100-mark single paper.
Yeah. So
and pediatrics is all this. First 10 chapters are general pediatrics in OP-GY, and OP-GY is a go-to standard book preferred by everyone in general, I feel. And the first 10 chapters are the basic stepping stone towards pediatrics, and you have to know them at any cost. You like the developmental milestones, growth, loss of development, and then immunization, nutrition. All these things are very important, the basics of pediatrics. If you don't know this, you don't know anything in pediatrics. You have to know them.
This itself actually forms the time consuming part when we study pediatrics. The systemic goes on in one flow.
And because we would have already studied medicine, while studying in for the final exams, we already finished medicine, and almost everything is similar, or at least about 75 to 80% will be similar to medicine while studying pediatrics. So systemic pediatrics becomes slightly easier, but I'm not telling that you have to ignore systemic pediatrics. You have to study that, because the dosage would be different, few manifestations in kids would be different, and and especially few organisms which cause the disease would be different. So you have to study that, but it is slightly easier, and it would go in a flow. And GHI is the go-to book, and there is another textbook called Gupte, which is also a good book, and few points which are not there in GHI are given in Gupte. That's what my friends told. I'm not sure, because I've not referred it personally, so I'm not sure regarding that. But there is this book called Gupte.
And there are some parts which aren't there in GHI, especially for newborn, the birth trauma related and RDS meconium aspiration, these topics towards the ending are not in depth given. All of that is actually covered in Datta for obstetrics. So there are like these 3 chapters on newborn itself, which are there.
Newborn itself in Datta.
Complications which are encountered then. So that in that book, it is all given in detail. So what is missing here, one can read from
Datta.
So that covers, just complements each other.
Yeah.
Yeah.
And for clinicals, there are 2 books, Meherban Singh and Aruchami, which I have referred as Aruchami. And it's like a mini textbook actually. It's also given in great detail. Cardiovascular system part in Aruchami. I substituted Aruchami for Ghai in cardiovascular system and studied for all the cyanotic heart diseases and acyanotic heart diseases. It's a pretty good book, and but few data. There are variations like um, mid-upper-arm circumference
like
or any
temperature and then anthropometry and stuff. So that
anthropometry stuff are slightly different compared to Ghai. So I would suggest to refer to these standards from Ghai itself. But clinical methods and all those things are good with Aruchami. So I would say that. Meherban Singh, how is it, Priya? How have you referred to it?
I only read through the newborn CNS examination from Mbbs because almost everything was given in Aruchami itself. Yeah, the thing is, it's pretty simple in Aruchami because first they've given the proforma, and then after that you find all the relevant. It's not in a Q&A format, but each thing which is there in the proforma, how it is examined, everything is given in depth. And then after that, I don't know if the diagnosis part was mentioned or not, but it's all given in the book though. And all the Viva questions, whatever is asked, is also included. So that goes in great depths, right from the first chapter as to how you take a pediatric history, anthropometry, to all the systemic things we encounter. Everything's given in the book. So that is as simple as it gets in pediatrics. It's just one book here and one there.